At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. Now, it's no secret good health is vital for individual well-being, allowing people to live longer and have a better quality of life while preventing disease and reducing long-term healthcare costs and medical expenses. So to help the community prioritize their health, South Texas Health System hosts these monthly Let's Talk Your Health webinars. By discussing common health issues and offering important education, hopefully we can all help residents prevent, manage, and delay serious health issues. Now, in this installment, we'll be talking about kidney health, a critical part of overall health and well-being. The kidneys perform a host of important jobs in the body. Known as renal function, the kidneys work to keep the body in a state of chemical balance, regulating substances that are both helpful and harmful. Unfortunately, illnesses like chronic kidney disease can impact how the kidneys function, leading to an increased risk of serious health problems and death. So what causes kidney disease? Who is most at risk for kidney problems, and how are they treated? Well, today we're joined by Dr. Murad Al-Sabag, the Program Director of the Internal Medicine Program with the STHS GME Consortium, with all of those answers. Thank you, Dr. Al-Sabag, for joining us today.
Thank you. Thank you for having me. Thank you very much.
Now, you have been in the Valley for 13 years, and you have been in the hospital setting, working with residents at various hospitals around the community. Have you seen that kidney health is a problem that we're seeing here in the Valley?
Well, yes, definitely. First of all, thank you for having me, and hopefully today we'll be able to provide to the community a very, very important message about kidneys. Yes, actually, kidneys, as you mentioned earlier, they are one of the most essential organs in our body. We cannot live without kidney function. And here in the Valley, we have a very high incidence of kidney disease and kidney failure.
Mm-hmm. Now, we talk about those numbers globally, and they are in the millions. But in the U.S., it's at 36 million people that have chronic kidney disease, and 90% of them are unaware they have it. So do you come across the patients in the hospital setting who had no idea, once you tell them you have kidney failure or you have kidney disease, that they had it?
Yes. Correct. Actually, in a matter of fact, kidney disease, or what we call it, chronic kidney disease, or even acute kidney failure, AKI, these terms used for patients who are having abnormal kidney function, and it is painless, and the patient does not really feel anything just by doing the blood test, or when it is very advanced, when we get to the stage 5 of the kidney disease, at that time when we have the symptoms. But in the stage 1 to 4, generally the patient does not really know if they don't do blood or urine test and urine test.
And I know we talk about the importance of seeing your doctor regularly, and that's why this is really important, because you may be living with it for years without really knowing it, and be hitting those different stages, and then until you get to the more acute stage where you are life-threatening, then it could be very difficult to treat.
That is correct. So unfortunately, most of the patients who don't have a regular checkup for their kidneys or managing their health, if they have a deterioration of their kidney function, they end with kidney failure, and they end in the hospital with what we call it acute kidney injury with advanced kidney failure, and the term for that called end-stage kidney disease.
Okay.
Unfortunately, when we get to the end-stage kidney disease, it is too late to do anything for the kidney. At that time, you need to do what we call it renal replacement therapy, which going to be very much the dialysis at the moment. Then maybe later on, if the patient is lucky, he or she will get a kidney transplant. But they're going to go through the process of the dialysis, which is, I think, it is not something anyone in our community would like to go through that.
Mm-hmm. And when we talk about transplants, yes, there is a waiting list that you're put on, but not everyone qualifies for a transplant. You have to have good health with just despite the poor kidney, but you have to have all those other issues in control, your diabetes, your high blood pressure, your heart health and all. So it's not just, I need a kidney, I'm on a list, and they give me a kidney.
As you know, transplant is a surgery, and it's considered to be a kind of not minor surgery. It's a major surgery, and the important part of the transplant that after the transplant, the patient needs to take medications, which we call them immunosuppression medications. These medications are going to suppress or inhibit the immune system for lifelong. So the patients need to be healthy before the kidney transplant. Otherwise, if their heart is not strong enough, or if they need oxygen, for example, or they're very, very fragile, they cannot go through the surgery and after the surgery. So it's a complicated process to go through. But if they go through it and they really do a good job with the surgery and after the surgery, they will live good at 20 years if they take care of their kidneys without needing for dialysis. So that's why consider the kidney transplant considered to be the best option for kidney failure. Now, as you mentioned, not every patient qualified for kidney transplant. That's why the evaluation takes really long time. It may take about 6 months to evaluate the patient to make a decision if this is a good candidate or not good candidate. Mainly from the cardiovascular standpoint, we want to make sure that the patient's heart tolerate the surgery and the patient's arteries able to supply the blood to the kidney to let it work.
But the biggest message here is that if you protect your kidneys today, you don't have to worry about dialysis. You don't have to hopefully worry about a transplant.
Correct.
As long as you're taking all of the steps today to protect them.
Exactly. And more than 85% of the patients go for kidney failure. They could be able to protect their deterioration of kidney function if they do some kind of a prophylaxis measurements in before, which we're going to go over with details in the presentation.
All right.
Yes.
And education is key, and you have a great presentation for us. So let's get started.
Okay, thank you. So we're going to start with talking about what is kidney. So the kidneys are a pair of organs measuring about 4 to 5 inches long, and they are located at the back of our abdomen. They are about in centimeters. In males, they are about 13 centimeters. In females, about 12 centimeters. We have luckily God gave us 2 kidneys, and that's really what making us healthy from this standpoint. The anatomy of the kidney, which I have a picture here, but let's go over so the kidneys have parts in the kidney, and each part has its own job. So the most important part, what we call it the renal cortex, which is the out layer of the kidney. It is the outer part of the kidney. It's about 2 centimeters in the healthy kidneys. Then deeper we go to the medulla, which is the inner part containing the pyramids where urine is concentrated. So the outer part of the kidney where we make the urine, then the inner part of the kidney, which is called the medulla, and that's part the urine starts to be collected. And in the outer part of the kidney, the cortex, which is the main part of the kidney, we have small tiny organs called nephrons. Believe it or not, these are very tiny. You cannot see them by your eyes. They are the functional units of the kidneys, and each kidney of the human contain about 1 million. So we born with 2 million kidneys, 1 million in the right kidney and 1 million in the left kidney. Renal pelvis, this is where we collect all the urine. This is the funnel shaped structure that collect the urine from the nephrons. And the ureter, that's the tube connecting the kidney all the way to the bladder. Then we have the rest of the system where we get rid of the urine. So I'll show this picture. So we have the cortex is in the outer side of the kidney. This is where most of the work done, and the medulla is, these are triangle darker shape, and these are the medulla. There where we collect the urine, and we have the pelvis. Then we go all the way down to the ureter. Now the round one, like the ball, and it has all of these connections. This is where we call the nephron. Now, believe it or not, this you cannot see it in your mere eye, but interestingly, the dialysis machine, which is about 80 pounds machine, a huge machine, about 4 to 5 feet by length, tried to mimic this very tiny organ. And we have, as I said, million of them in the right side and million of them in the left side. So what the kidney does, this is very important for all of us to know, that the kidneys does essential functions. We cannot live without it. So the blood passes through the kidneys, and the kidney will sort from the blood, take the wastes and remove it, and also control the body fluids. We drink fluids every day, and if this fluids we don't get rid of it, it's going to stay in our body and make us sick. So the way to get rid of it is through the kidneys. So we control the body fluids balance through making the urine. And the urine, what does it have? It has water, and it has the waste or the toxins. These toxins come in from the food we eat and our daily life activities in our body. Also, believe it or not, the kidney will provide hormones. So the kidney, beside being an organ to make the urine and to waste the toxins, also it controls the anemia, it controls the blood production, and also it controls the vitamin D. Vitamin D, as you may know, it is a very, very important vitamin for our bones and the rest of our body. And to have the vitamin D as a hormone help us in controlling our bone health, we need to have this activated. And the way to activate it is through the kidney. And that's why all the dialysis patients, literally all of them who don't have functioning kidney, we need to give them the active form of the vitamin D. So to summarize it, kidney get rid of the toxins, get rid of the extra fluids, regulate our blood pressure, take care of the activation of vitamin D, and create send a hormone to the bone marrow to make red blood cells. So in this picture I'm showing here, so it helps in regulating the bone metabolism, it helping in making blood, and also it take care of our blood pressure and get rid of the extra fluids and the toxins created from the food we eat. So it is, as you see, it's a vital organ, connected all our organs together and take care of all the blood, the waste we have in the blood. So kidney disease. When we say this patient has kidney disease, what is kidney disease? Kidney disease means that when the kidneys are damaged and cannot really do the function we just mentioned. So which slowly will accumulate the waste and will build up fluids. So this damage can happen slowly over years, and it is painless. So that's why the patient does not really feel any symptoms until it is very advanced at the stage 5 of the kidney disease. So there are two types of kidney disease, two big groups of kidney disease, I want to say: acute kidney disease and the chronic kidney disease. The acute kidney disease, this happen in the sudden change of the kidney function, secondary to a type of illness happen or certain medications we take. For example, if we don't drink enough fluids in the next few days, the kidney function gonna be deteriorate, and that's what we call it acute kidney injury secondary to dehydration. If we take a lot of medications which could be toxic on us, it will give us actually acute kidney injury secondary to taking these medications. So this is the acute. So that means the patient's baseline kidney function either normal or stable, and within 24 hours or 48 hours, the kidney function deteriorate to half of the kidney. So what we're going to talk about now in the next few slides, creatinine, which is the indicator for the kidney function, if this number goes up significantly within the first 24 hours, that put us in the definition of acute kidney injury or acute kidney failure. Now, the chronic kidney disease, it happened from chronic diseases, which I'm going to go over, namely diabetes and hypertension, the main two major kidney disease reasons. And this happened within years, and patients within 15 to 20 or 25 years will be losing their kidney function. And that's what we call it chronic kidney disease. So what are the main kidney diseases we deal with on daily basis? So in the clinic and in the hospitals, we see these kidney problems. I will go over some of the most important ones. So diabetic nephropathy is considered as one of the most common reasons for kidney failure. And a matter of fact, here in the Valley, unfortunately, 42% of our population having diabetes. And the uncontrolled diabetes, sooner or later, going to end with affecting the heart, the eyes, the brain, and also the kidneys. The kidneys are one of the preferred, I want to say, organs and targets for the kidneys. Most of our patients I see on a daily basis, and my colleagues in the field see on a daily basis, most of their kidney disease is related to diabetes. So that's why very important to control the diabetes. High blood pressure, hypertension is the other kidney disease reason. High blood pressure is considered to be one of the main reasons for kidney failure. It consists about 30 to 35% of the reasons for kidney failure, and even it is higher here in the Valley. We have other reasons. Kidney stones. It's a common reason, and there are forms that run in the family. So there are families having kidney stones, and also there are forms acquired and not drinking enough fluids and consuming a lot of soda. That will be reasons for these kidney stones. There is a very unique type of kidney disease called glomerulonephritis. This glomerulonephritis secondary to inflammation, and most of the cases autoimmune inflammation, which our immune system attacking our tissue, attacking our kidneys, and cause a very unique type of disease called glomerulonephritis. This type of disease, most of the cases we need to have a biopsy of the kidney to diagnose it. We have pyelonephritis, which is infection in the kidney. So if the patient has what we call it UTI, urine tract infection affecting the bladder, and if this is not treated very well, and if the patient has risk factors like diabetes, this will put the patient in risk of having pyelonephritis. Pyelonephritis means inflammation in the kidney, which is most commonly secondary to infection. This is considered to be emergency case or semi-emergency case. Most of these patients, they will require IV antibiotic to save their kidneys. I also have a disease which is called polycystic kidney disease. Most of these cases are inherited. It happen in the family. So the kidneys will start to build cysts, small cysts next to each other. By age of 45, most of the patient will start to have at least a chronic kidney disease stage 2 to 3. And generally, most of patients, I want to say by age of 50 plus, they will have advanced kidney failure. Kidney cancer is one of the reasons for kidney failure. Kidney cancer is common, especially in smokers. So that's also one of the recommendations I'm gonna bring here about the smoking. We have also nephrogenic diabetic insipidus. This is also another very unique type of disease. The patients will not be able to concentrate the urine, so the patient will lose too much of urine while they are having this disease, and that ended them with some electrolyte imbalance, especially the sodium will be affected. So as I said here, a big group of diseases related to kidney failure, but mainly diabetes and hypertension are the main two reasons for kidney failure. Okay, what are the main factors for developing kidney disease? As I mentioned, diabetes, it's about I want to say 35 to 40% incidence rate for kidney failure related to diabetes. High blood pressure or hypertension, it's about 30 to 35% of the reasons of the kidney failure. They come in from uncontrolled hypertension. Cardiovascular disease, interestingly, kidneys are very sensitive, believe it or not. So whenever the heart, the lung, or the liver affected, the kidneys right away respond with this, and they kind of shut down. That's why we have, if the patient has a cardiovascular disease, the kidneys will start to get damaged slowly. And a couple mechanisms. One of the important mechanisms, the kidney will not get enough blood supply because the heart is not strong enough. Family history of kidney failure. If the patient has a kidney disease in the family, as I mentioned earlier, polycystic kidney disease or kidney stones, they will have a high risk to develop kidney failure. So we recommend all these patients to check up with their primary care physicians, have a blood test frequently to make sure that their kidney function is stable enough. Now, there's another important reason for kidney failure I would like to bring here, and I would like to aware the community about it: the overuse of painkiller. We all at our homes have ibuprofen, Advil, Aleve, Motrin, and we use it very frequent, and we may use it on daily basis. Some of the people who really have soreness in their muscles or in their bones. So these medications are okay to take care of the pain, but they are actually toxic on the kidneys. Especially if you know that you have a chronic kidney disease by fact and you don't have a normal kidney function. I personally, as a specialist in kidney diseases, recommended you to don't take any of these medications. Maybe Tylenol will be okay to take for pain if you need it, but definitely you need to consult with your primary care physicians or your nephrologist. But I strongly recommend you to don't take any of these medications. Even if you have a normal kidney function, taking it with moderation is what I recommend. Don't overdo it. So these what we call them the non-steroidal anti-inflammatory drugs, or the NSAIDs. That's the known name of these medications. What we need to know here. So early kidney disease has no signs or symptoms. This is a scary term I want to say here. You don't feel any symptoms, any pain, any symptoms at all if you are in the first few stages of the kidney disease. You will not really feel that you have something wrong in your body until you get the very advanced kidney failure, and that time it could be a little bit late. So the other important fact I want to connect to the first one I said, that kidney disease can be controlled, or can be, I don't want to say can be treated, that's not an accurate term. I want to say can be controlled or can slow down if you detect your kidney disease earlier. If we find that you have a kidney disease earlier, when you're still in a chronic kidney disease stage 1 or stage 2, the nephrologist and the primary care physicians, they are able to slow down your kidney failure to the point you may not require dialysis to the rest of your life. So it does not happen right away, and I'm talking always here about the chronic kidney disease. So who are in risk for kidney failure? As I mentioned, diabetes, hypertension, and family history, and using too much of NSAIDs. These are in risk, but also there are specific race in risk of it, like African American, Hispanic, and American Indians. They have a little bit higher risk than Caucasian and others. So how we find that we have kidney disease, what we test for. So testing is the only way to know the health of our kidney. It is very important to check for kidney function if you have any of the key risk factors. As I mentioned, if you are known to have diabetes or hypertension or family history of kidney failure, or if you use a lot of these painkiller medications, it's better to check with your primary doctor to see how's your kidney function. Check electrolytes, a blood test, and urine test. Okay, so what we check, these are a little bit deep. I'll try to make it as simple as possible. So one of the very, very important tests we check, it's called GFR, which is the glomerular filtration rate. This test will give you very much almost, I want to say, percentage of the kidney function. Like with this test, we will tell if you have 60% of your kidney function, or if you have 50%, or if you have 12%, 10%. So this number does not give us the percentage. Actually, in the medical term, it gives us what we call it milliliter per minute. So if we have 60, what we mean 60 milliliter per minute. But to explain it easy for our patients, we tell them you have 60% of your kidney function. So that's what's called GFR. So please, when you see your primary doctor, ask them about your GFR, and remember this number, because if you're going to see any other specialist or you go to the hospital, you need to tell them that I know by fact that my GFR is 80%, for example. Urine test. So to check the urine is very, very critical. Reasons during the urine test, we check for few things. Number one, we check if the patient has infection or no. Number two, we check if the patient has a blood in the urine, which could be the first sign of kidney stone or kidney cancer. We can actually find the kidney cancer just by checking the urine analysis and find the blood in the urine. Now, most importantly, from these two terms, to check if we have any protein in the urine. So the protein in the urine, or what we call it the proteinuria or albumin urea. The albumin is our main protein in our plasma, and if usually the kidneys should not let the albumin leave to the protein, we should to the urine. So we should not really leak any of protein in our urine. If we see protein in the urine, that is an important alarm or a sign for us to check with our kidney doctor, because you will have a kidney disease if you have a protein in the urine. So the protein in the urine reason has multiple reasons. The most common reason of a protein in the urine by far is the diabetes, and that could be actually the first sign we find the kidney disease. You may have a normal GFR. That the first test I said you may have like 100% GFR, which means you have 100% kidney function. But if the minute you start losing a protein in the urine or albumin in the urine, that is the time when you have a kidney disease, regardless how much your GFR. Now the next test, I'm sure a lot of you heard about it. It's called serum creatinine. We know creatinine is one of the toxins after our daily work in our muscles. It is a toxin produced by our muscles and goes all the way through the kidney, and we get rid of it in the urine. If the kidney is not functioning well, so this creatinine gonna accumulate, which means the higher the creatinine, the worse the kidney function. The lower the creatinine, the better the kidney function. So we use this test heavily every day in the hospitals and in the outpatients. The normal creatinine, it range because it's related to the age, related to the gender, related to how much of muscles we will have. But generally speaking, if your creatinine is below 1.2, generally speaking, your kidneys are healthy enough. But as I said, it depends on the age, and the weight, how much of muscles we have, and the gender, male versus female. Sometimes we do a test called the creatinine clearance. Creatinine clearance, what we do, we collect the 24 hours. We tell the patient to collect the 24 hours urine, and we send it to the lab, and we check for the clearance. And this test will tell us how much of kidney function. It is reflecting the GFR, the first test I mentioned, but it is more accurate because it measures the amount of the creatinine in the urine of the 24 hours. So it is one of the gold standard tests. It is not easy to do, but it's very accurate, I want to say. There's a test we do, it's called BUN, which is, again, this is one of the toxins breakdown of the protein we eat, and again, the higher the BUN, the worse the kidney function. We call it BUN or blood urea nitrogen or BUN. These are the terms. So as you see here, the higher the creatinine or the higher the urea or the BUN, the worse the kidney function, and vice versa. Okay, sometimes, and actually most of the times, we need to do imaging to look at the kidneys. So the ultrasound, if you remember the first picture I showed you, and we said that in male the kidney size is about 13 centimeter, 12 to 13 centimeter. In females, about 11 to 12 centimeter. Now with the ultrasound, we can tell how big the kidneys. The smaller the kidneys, the sicker, but that does not also correct in the other side. That does not mean the bigger the kidney, the healthier. But if the kidneys are smaller, that means the kidneys, they are not functioning very well. Also with the ultrasound, we can check if we have stones. We can check if we have any obstruction. We can also see if we have any cyst. As I said earlier in the presentation, polycystic kidney disease is one of the common inherited disease. And how we found it by doing ultrasound, and we see these small cysts. CT scan. Sometimes we ended with doing the CT scan. Now the CT scan, there are two types of CT scan with contrast and CT scan without contrast. The one without contrast does not hurt the kidneys. The one with contrast, because the contrast or the dye or the iodine, that is toxic on the kidneys. Sometimes we end with doing it for specific reasons not related to kidney, for the heart, for the lung, or for the abdomen. But the CT scan generally will give us a very detailed information about the anatomy of the kidney, how big are they, and if there is any obstruction or any disease in it. So we heavily use a lot of tests to help us with the diagnosis of the kidney disease. This slide, I'm sorry, it seems like a little bit busy slide, but this actually summarizes the chronic kidney disease. So I will go over it with the numbers. Again, it could be a little bit complicated, but if you save it for you to read it with details, that will help you. Where is your kidney failure, or what you need to do to avoid to get to the last stage. So these are the stages of chronic kidney disease. So we have 5 stages of chronic kidney disease: stage 1, stage 2, 3, 4, 5. Stage 5, unfortunately, this is when we have the end stage kidney disease, and that is very close when we need to start dialysis. Stage 1 is when you have GFR above 90. So you may have protein in the urine, you may have blood in the urine, but your GFR is still above 90. Stage 2, when your kidney function is about 60 to 90%. Stage 3, when your kidney function is from 30 to 60%, and this is the most common chronic kidney disease cases we have in United States. Stage 4 is when we start to talk about severe kidney failure, and this is when we have from 15 to 30%, and anything below 15%, generally speaking, is advanced kidney failure or end-stage kidney disease. So treatment, what we have now, we have chronic kidney disease. We want to make sure that we don't end with more deterioration, or what options we have. So we have medications, and we have dialysis, and we have transplant. Medications. So again, as soon as you diagnose with a chronic kidney disease, that will alert your primary care physician and your nephrologist to start you on a specific type of medications to slow down the deterioration of the kidneys function. So one of these most important medications we use, they called ACE inhibitors, or angiotensin converting enzyme inhibitor. It sounds like a little bit weird name, but if you remember, for the sake of remembering it, it's called ACE inhibitors. These medications, we as nephrologists use it very, very heavily, like lisinopril, enalapril, Diovan, losartan, olmesartan, big group of medications. These medications actually are the backbone of our outpatient clinic management for chronic kidney disease, and their job is to slow down the kidney failure by controlling the blood pressure in the mechanism inside the kidney. To keep the pressure inside the kidney within normal. Other medications we use, diuretic or water-pill medications. These diuretics, to get rid of the extra fluids. When we reach to a level of advanced kidney failure, our body start building fluids. If you remember, we talk about the kidney function in the beginning, and that when we use the diuretics. Diuretics is to get rid of the extra fluids. There are other enzymes, other medications we use to support. If we have advanced kidney failure, we're going to start to have anemia, so we need to give medication mimicking the hormones our kidney secrete. These called ESA agents, erythropoietin and others. Vitamin D is one of our core treatment for patients who start to develop vitamin D deficiency. obviously, beside these main treatment, we do the collateral treatments, which means controlling the diabetes is a key in slowing down the kidney failure, controlling the hypertension, controlling the high cholesterol, having medications for controlling the heart disease. So all of these perils, I want to say, work together in slowing down the kidney failure. Now, when we reach to a point that we have advanced kidney failure at the stage 5, at that time, we're going to start to have symptoms. We're going to be very sick. And I will mention what symptoms we're going to start to have, what we call it in a medical term, uremic symptoms. These uremic symptoms reflecting the accumulation of the toxins in our body. So we're talking about consistent nausea and vomiting, very weakness and fatigue, not able to sleep at night and being sleepy during the day, shortness breath, just from going from your living room to the bathroom, you feel windy and you have shortness breath because of accumulation of the fluids in the lungs and also swelling in the legs. These symptoms, generally what we call it uremic symptoms and advanced kidney failure symptoms. This is the time we need to start dialysis. Dialysis, there are two types of dialysis. One type called hemodialysis. So very much we connect the patient to the dialysis machine. We take the patient's blood, we clean it, and we send it back to the patient. And the peritoneal dialysis, we do the dialysis through the abdomen. So we put a catheter in the abdomen, we give it fluids, we let it be for about 30 minutes to 1 hour until these fluids take the toxins and we get it out. So these two types of dialysis, we use them on daily basis on our advanced failure kidney patients. These are life-saving modalities for saving the patient's lives. Now, if the patient is healthy, can be listed on the kidney transplant, which is, generally speaking, the best option for kidney failure. Kidney transplant could be from living donor or deceased donor. The living donor could happen as soon as the donor and the recipient ready, and the donor could be somebody who's related to the patient, father, mother, brother, sister, son, daughter, or could be somebody who's not related, either a friend or second degree relationship, I want to say. This is the living donor. The deceased donor is coming from somebody who is about to die. The family decided to donate his or her organs. We all would like to promote for kidney transplant because of multiple reasons. The main reason it's the healthiest way to manage the advanced end-stage kidney disease. Prevention. So as I mentioned earlier, control the blood pressure is a key in preventing the kidney failure. Our blood pressure need to be between 110 to 130. Anything above 140, that will be alarming for us, that we need to take care of it. We need to follow up with our primary care physicians. The good part of it, that we have a lot of medications to be taking care of the blood pressure, and the more you are adhere or compliant to the treatment, the better you control your blood pressure, the slower you end with the kidney failure. The other important thing is controlling the diabetes. As I mentioned earlier, diabetes is the main reason for kidney failure, and now we are living in really the advanced medicine of having a lot of options for diabetes. Diet is the main factor here, which I'm going to put a couple slides to go over it with some details. But diet is a very significant player in controlling the diabetes, especially here in the valley. Unfortunately, we don't have the best diet, so we wanna really work good to cut down the carbohydrate as much as we can. Stay hydrated. Not being hydrated will end with having dehydration, acute kidney failure, and maybe make the kidney stones or build up kidney stones. Maintain healthy weight. So we know by fact if the person lose weight, that will help in having a better kidney function, and the other way around. The kidneys will not get bigger if we put weight. So just very simple example. 2 kidneys taking care of a person who is 160 pounds is way different than the same kidneys taking care of a person of 240 pounds. So they're gonna work harder in the obese person. Eat kidney friendly diet. Vegetables, low salt diet, low carbohydrate diet, regular checkups, and this is the message I want to pass to all my lovely community population here in the Rio Grande Valley. Please check your blood test at least once every 6 months or once every year. If you are known to have kidney failure, you may need to check your blood and urine test at least twice a year. So this slide showing us the treatment options for kidney disease. Fluid control, medications, the diet changes or lifestyle, what we call it lifestyle modifications. Cut down the salt, cut down the carbohydrate. We are heavily here using in the valley tortilla, tamales, tacos, rice, bread, potato. These delicious food, but they carry a lot of carbohydrate, which can end us with having overweight and abnormal cholesterol, and more importantly, diabetes. So diabetes and the blood pressure and blood sugar control, these are very, very important things. Then unfortunately, if we end with the advanced kidney failure, the dialysis and the transplants are the two options we have. So I put a unique slide here for the diabetes because, as I mentioned earlier, it's the most important reason for kidney failure. So all the patients need to have a better control of their diabetes. They need to have a better control of their blood pressure. We need to have a lipid management, which is a cholesterol management. We need to quit smoking, and also we need to adjust our nutrition, decreasing the salt and decreasing the carbohydrate. Exercises is a very, very important to decrease the risk of obesity and diabetes. For the most of the patients, we're going to start them on the ACE inhibitors or a specific type of new medication to slow down the kidney failure. So the take-home message, I'm almost done, and thank you for listening. Actually, the take-home message, kidneys are essential organs for our life. They are filtering the waste, they balance the fluids, and they regulate the blood pressure. Prevention is a key in maintaining the kidney health. Manage risk factors such as diabetes, hypertension, and obesity. Early detection through regular checkups can prevent or slow down the progression of the kidney disease. Lifestyle modifications is very important. Balanced diet, regular exercises, staying hydrated, and avoid smoking. And as I mentioned earlier, avoid using painkillers very, very frequent. Treatment options are dialysis, transplant, available when we have advanced stage, and early detection of the kidney disease is essential. So just to summarize it, lifestyle, get tested, monitor your health, and do exercises. And I would like to stop here, and thank you for listening.
All right, thank you so much for all of that information. Now let's talk a little bit about the complications associated with chronic kidney disease. So obviously you're dealing with the damage that you're experiencing to your kidneys, but you could have other issues that you would face. There's issues like gout and other issues. What are some of the things that you see with patients with chronic kidney disease?
Very good question, Tom. Gout is one of the complications related to advanced kidney failure, because gout related to uric acid and not clearing it, it's going to accumulate in the body and will give us gout arthritis, which is joint inflammation, which could be really significant. Now, one of the very important complications related to kidney failure, especially advanced kidney failure, is cardiovascular. Okay. So as we discussed earlier, kidneys control the calcium and the vitamin D. Now, if we fail in this, you're going to have this calcium accumulated in the heart and in the arteries, and the patient's going to have more risk to get heart attack. And if you look at the people who die after they start on dialysis, most of them, they die because of cardiovascular complications. So heart is our main organ, and unfortunately it gets compromised significantly from the high amount of the toxins in our body, the calcium and the phosphorus namely.
Mm-hmm. Now you talked about the biggest risk factors, obviously heart disease, high blood pressure. They say that 1 in 5 adults with high blood pressure have CKD, so they will have chronic kidney disease.
Correct. So hypertension, it's a silent killer, I want to say. It slowly start damaging these small glomerulus, the one I mentioned, the small tiny nephrons in the kidney, start to damaging it. Now the scary part of it, that you don't feel it. even hypertension itself, it is a painless disease. You don't feel it until it is very, very, very high. So patients could have hypertension for 10 years and he or she is not aware about it, and this could be damaging the kidney. Yeah.
And then you talked about overweight or obese, and I like how you mentioned how 2 kidneys working for 160 pounds, it really does put it into perspective versus 2 kidneys working for a person that weighs 240 pounds, and what a difference that makes. And we talk about obesity in general with affecting joints, affecting your heart, affecting so many parts of your body, but your kidneys don't grow when you grow, and so they have to work harder.
Exactly. Just imagine a car with a small engine. So if you bring the same engine and having a bigger car, this engine cannot really drive the car, regardless how much of gas you push on. So same thing. And on the other way around, if you start to lose weight, your diabetes will be improved, your blood pressure will be improved, the sleep problems will be improved, cholesterol and heart disease, and also, and for the sake of this discussion, the kidney function actually will be improving significantly. So yes, obesity or overweight are very, very important, especially here in the Valley. I think maybe we are one of the top 5 cities or areas in the country. We have a high incidence of obesity, and it is as important as heart disease and diabetes to take care of the weight with exercises, adjusting the diet, and follow the recommendations of the primary doctor.
And it may seem like a daunting task if anyone is struggling with their weight, and when you know you have a goal weight that you want to get to, it may seem difficult, but even losing 5 to 10% of your body weight, your current body weight, can make a big difference in your health. Is that right?
It is correct. Like there is a very common disease related to obesity called obstructive sleep apnea, that when we stop breathing while we are sleeping and we snoring, literally this disease you can cure it by taking off 10% of your weight. Same thing of diabetes. You may drop one or two blood pressure, blood sugar medications just by losing 10% of the weight. I will just give a general recommendation about the weight loss here, because beside being a kidney and kidney transplant physician, I am also American board certified in weight loss, and I'd like to give a quick recommendation. So I tell all my patients and my community, eat less, eat better, and be active. Eat less, cut the amount of the food. Simple. Eat better is the most important one, switching from unhealthy food to healthy food. So we talked about the unhealthy food, the food with high carbohydrate. Switch to healthy food. Generally, the vegetables, the fruits with low sugar, and be active. Exercises. The easiest, simplest, and the cheapest exercise is walking. Just start your future or your day with having a walking. Like start with 20 minutes a day walking, then increase it minute by minute to get to the level what the recommendations, which is about 45 minutes daily of walking.
Now, when it comes to the symptoms of chronic kidney disease, obviously you talked about how in the early stages you're not really going to notice anything, but when it becomes more advanced, what are some of the things that you'll start to see?
Correct. So that's what I mentioned, which they call it the uremic symptoms. So you're going to start seeing a swelling in the legs. This is common. You're going to start seeing getting shortness breath with any any activities. You're going to start feeling tired, fatigued, not willing to do anything. You may get to, in the advanced stage of the kidney disease, you'll have nausea or vomiting. Also, in the advanced stage of the kidney disease, the process of the thinking, like we'll have a foggy thinking and not making sense in thinking. Patients will not able to sleep at night, and they like to sleep during the day. So all of these symptoms taken us to the stage 4 and 5 of the kidney disease.
So when it comes to your urine, because there is a need to pee often, is there a color? Like I know we look at colors and what colors should be normal for urine. So is there an indicator that your kidneys are failing with the color of your urine?
So maybe the amount of the urine is indicator. So
Okay.
we should I mean, if we notice that we are making low amount of urine, that's a sign that we need to check. It
Okay.
could be either because of obstruction or we are not drinking enough fluids. Now coming to the color, obviously if you have a dark color, that could be either blood in the kidney, blood in the urine, so need to be tested, or it could be also related to dehydration. So if you do fasting, for example, for long time, you will see that the urine gonna be the amount will go lower, and also the color will be dark. If you make too much of urine, not consistent with the drinking enough fluids, that's also another sign of a disease, that there's a hormone is not regulating the controlling the amount of water the kidneys secrete. So if we lose this control, so you're going to be making a lot of urine and you are not drinking enough fluids. So this is also another disease. Generally is the yellow amber color of the color, that's the normal color of the urine. Now what also I always ask my patients, when you go to the bathroom and you urinate, do you see foam in the top of the urine? Foam, generally speaking, reflect that there is very high amount of a protein in the urine.
Okay.
This is a very important sign the patient need to go to check with their kidney doctor or with their primary physician to check if they have a protein, if they have a lot of foam in the top of the urine in the toilet. Yeah.
Okay. Now, how long can somebody live? And I know this will obviously vary with whether you take care of it well or not, but how long can someone generally live with chronic kidney disease?
Good question. Actually, it depends on how you control it. I have patients, they have a chronic kidney disease stage 2 to 3 since 15 years, and they stay at stage 2 to 3. And I have patients ended from stage 1 to stage 5, as we mentioned in the previous slide. They ended within 5 years. So there's no specific timing for that, but I want to say to get from stage 1 to stage 5, for example, in the diabetes, which is the most common, may take about 15 to 18 to 20 years. And again, this is varied depending on how you control your diabetes. If you control the diabetes very well, you may not end with a CKD stage 5 or chronic kidney disease stage 5. If your diabetes uncontrolled and your sugar very high always, you may end with on the dialysis within 5 years.
Now, we hear a lot about nephrologists. So when would you be referred to see a nephrologist if you have been diagnosed with kidney disease?
Correct. So from this place, I would like again to thank you for having me here as giving awareness about the kidney health. As we mentioned earlier, it's essential organ for our life. So I recommend all my colleagues as a primary care physicians, family doctors, to refer the patients to the nephrologist as early as they are stage 2. Now, if the patients already have a proteinuria or a protein in the urine, it is by default need to be seen by the nephrologist. And the nephrologist will decide if he or she will see the patient once a year or once every 6 months or once every 4 months or 3 months or monthly. That's depending on the stage of the kidney disease. But I ask all my colleagues, please start referring the patient as early as your patient with a chronic kidney disease stage 2. Now, the general recommendations, actually, even the CMS and the Medicare recommended, if you have a patient with diabetes more than 5 years, it is generally recommended to send the patient to the obviously beside endocrinologist and other subspecialists to check their feet, also to the nephrologist to check if they have any protein in the urine. The minute they have a protein in the urine, this is like the timing will start to kill. So we want to make sure that we slow down the kidney failure. So stage 1 to 2, Tom, I think that's the best time to start referring the patients.
So how can you tell the difference between back pain and kidney pain? Because I think it can be a little bit confusing because they're sort of in that lower back area.
Very good question. I like this question, actually. Kidney pain, there are very few cases related to kidney give you pain.
Okay.
Kidney stones or kidney infection. So the kidney stones, generally speaking, the patient will have other symptoms. They will pass blood in the urine. The pain goes from the back all the way to the front. They know that they are known to have a history of kidney stones. Kidney infection, the patient will have fever, nausea, vomiting, burning with their urine when they urinate. So generally, if you have isolated back pain, generally it is not related to the kidney, generally speaking. That's most likely it is muscular, especially if it increase or decrease by moving, or if it is related to lifting heavy stuff or doing like in the gym, lifting heavy objects, or like there are triggers for it. This most likely these are related to muscle pain more than kidney pain. The kidney pain, as I said, happen when it is either related to kidney stone or infection, and in both cases you will have urine symptoms.
Okay.
You'll have burning in urine, you will have blood in the urine, you will have fever, you will have chills. So there are other symptoms related to the back pain.
Now you went over a lot of ways to keep the kidneys healthy. Don't overdo certain medications, so ibuprofen and those NSAIDs. You have to really be careful with your use of those.
Correct.
Take care with antibiotics. Why do you have to be careful with antibiotics?
Very good question. I'll give general recommendation about the antibiotics, then I will talk about the kidney specifically. So antibiotics, it's not recommended to take it right and left without really confirming that we have a bacterial infection. If we have a viral infection, antibiotic is not used for viral infection, will not really do anything. Because we all have habit, unfortunately, that especially when it comes to our kids, they say they get sick, runny nose, sneezing, coughing, oh, give them antibiotics. So that's not, if the patient not confirmed that he or she has bacterial infection, either urine or throat or pneumonia or skin, the patient does not require antibiotics. Now, on the kidney side, there are some antibiotics, they damage the kidney. So we don't allow to give it to these patients, especially if the patient has kidney failure. There are good groups of medications. I want to name a couple of them, maybe gentamicin. It is very well known, especially in old medication. There are some physicians still using it, and it does give kidney problems. Now, if the patient's having advanced kidney failure, what we turn to use safer medications, non-toxic on the kidney, but even with that, lower dose. For example, instead of taking once a day of this medication, we use it twice a week only if the patient has already advanced kidney failure. So we want to be very careful with using antibiotics because we are using it very frequent. So want to be careful with using it.
Another one is to skip herbal supplements. And I know a lot of people see a whole bunch of ads on television for herbal supplements, but you don't necessarily know how they're going to affect the kidneys in a lot of instances.
Actually, herbal supplements, some of them damage the kidney, and actually we get it a lot from patients who never had any kidney failure and now ended with kidney failure. So please don't use it if you don't really consult with your primary physician. Now I want to talk to a specific group of patients who are the post-transplant patients. These are no supplements. Cannot take these herbal supplements because they're going to interact with your immunosuppression medications, and they're going to, believe it or not, they're going to may end with rejection because you're taking the medications as your doctor told you, but now you try to use a specific type of tea or whatever, and you drink it, and boom, you end with high creatinine and kidney failure. Why? Because these herbs interact with the medications we take. So we want to be very careful. I want to run it with the primary physician, or if you have a kidney physician, just to bring it with you to read what's the ingredients in it and to decide if these are okay to take from the kidney standpoint or not.
Now, it says drink plenty of water, but is there such thing as drinking too much water? Because I know nowadays we're carrying these big jugs of water. Is it bad to drink too much water for the kidneys?
I want to say in specific cases, yes, because drinking too much of water, it may end us with having lower sodium in our body, in a specific group of patients. So when we say drink plenty of water, maybe about 40 to 60 ml per kilo. So to simplify it, maybe about 2 to 3 liters a day of fluids. And when I say water, I don't mean water, I mean all type of fluids.
Okay.
So if you drink coffee, tea, obviously want to make sure that we don't drink too much of coffee to don't have caffeine in it, which could be actually affecting the whole system. There's one thing I forget to mention, I'm sorry, healthy sleep. It was studied very well that patients who sleep healthy, they have less incidence rate of developing kidney failure versus patients who don't sleep healthy. There are reasons behind it. One of the most common reasons when we don't sleep healthy or sleep enough, I want to say when sleep 2 hours or 3 hours, or we don't sleep healthy, we generally speaking will have higher stress hormones. I want to say our hormones, stress hormones are higher. These higher stress hormone will increase the blood pressure and down the road will affect the patients. If you bring 100 people sleep 2 to 3 hours a day versus people sleep healthy, which is 6 to 8 hours night sleep, nighttime, you will see these people who sleep healthy have less frequency to develop kidney failure compared to the people who sleep less. Mm-hmm. Why I brought the sleep? Because it's very, very important, especially for the people who work at night. It's highly recommended to find a few days a week to sleep at night. This is how God created the night for us to sleep in it. Mm-hmm. Yeah.
Now, with early detection being key, how often should we be seeing our PCP, our primary care physician, and getting a blood test, a urine test, or whatever we're going to need?
Right. I want to say maybe every 6 months, twice a year. If we already diagnosed that chronic kidney disease stage 1 or heading to stage 2, I don't want to wait more than 6 months.
Okay. And if you have a family history and you are at risk for it, then you definitely need to be seeing them regularly.
Correct. Actually, there are as I mentioned, the polycystic kidney disease. This is one of the common inherited disease. Actually, family members need to be tested starting from their adolescence, like 15, 16, 18 years, because they will start showing some of the features of the kidney disease. Kidney stone, as I mentioned, it could run in the family.
All right. Well, thank you so much, Doctor, for joining us. We really appreciate all of the information. We need to bring you back more often because you know everything there is to know about everything, it seems like. So thank you for sharing your knowledge with us today.
Thank you. My pleasure. And I'm very, very thankful to you to having me today to bring this message to the community. Our community need the awareness about the kidney and about the eating healthy and everything about diabetes and hypertension. And thank you again, Tom.
Thank you. Thank you.
And
that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, April 15th from 5:30 to 6:30 p.m. when we will be discussing Parkinson's disease. Like and follow the South Texas Health System Facebook page for additional information. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit STHSLetsTalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.